machine certainly knows how to hit those buttons, just the right ones. Fellow Toastmasters, I'm going to talk to you today about a topic that I was kind of prepared to talk about a couple of weeks ago when we had our healthcare debate, which didn't happen. My computer broke, the hard disk crashed. You know all about this, right? And I lost the entire presentation that I had made about this topic. But prior to doing that, a week before, I had just jotted down like 4 thoughts on here. So I did discover that in my stack of papers, and I thought, okay, I can just get up and talk about that. The topic of my talk is healing for all. Now, what I want you to do, you probably have formulated some kind of opinion about the topic. The topic was at the debate whether we should have private healthcare or we should have socialized, is what you had called it, which I disagree with. It's not socialized. But regardless of that, you get the gist of the meeting. If you have made up your minds, please have, can I use it this way, lithe minds. Yep. Be a little more flexible and listen to what I have to say. What I'd like to propose is that the debate is not between private versus socialized. Socialized has such a big stigma attached to it in this country. What we should be thinking about is, do we want for-profit healthcare or non-profit healthcare? Think about that. In this country, we are built upon the spirit of business, open and free business, which is wonderful, and I'm in favor of it. But I believe there are some things where the motive, profit motive, actually hurts the outcome. And in this case, healthcare, I believe it's a key one. Think of it this way. We have a system in the United States today where not only we have the doctors and hospitals and nurses who I don't have any issue with working for profit. They should be making a profit. They went to school for X many years, they have put up their money building hospitals or what have you, and they're seeing patients, they're helping people. Yes, they should make a reasonable profit. But we have an insurance system that is making enormous amounts of profit. What is this insurance system doing? We have a system where you and I and everybody else buys the right to go see a doctor and get coverage. And that right that you're purchasing is actually going to fatten up a lot of corporate pockets. Can you imagine if you have a fire in your home and you call up the fire department and they say, well, we'll come out, but do you have the right type of insurance for us to come out? Can you imagine a public service like that? Nowhere in the world do we have a service like that. Not even in the United States. Why? Because everybody knows when there's a fire, there's an emergency. You don't mess around talking about, do I have the right coverage or do I not? Well, you come down with cancer. You come down with diabetes. You come down with any kind of disease. What do? You go to a hospital, and you've all heard the stories. How awful it is to go to an emergency room, and the first question they ask of you is, can you pay for this service that you're going to get? Do you have proper insurance? In another way, translated is, are you actually making sure that somebody else is making a profit like you're supposed to? I believe the system is set up wrong. I believe profit, for insurance profit, is absolutely the bane of why the system is not working. We need to do away with that element. We need to have insurance for all. Everyone should automatically have the ability to go see a doctor and not have to worry about whether or not they're covered. And now, like I said, I believe that the doctors and the hospitals and the nurses and all the healthcare providers that are actually doing something in terms of healing people should be able to make a reasonable profit, but not people that are just pushing the paper. So I hope, in conclusion, that you have a little different view of this topic today, and that next opportunity that you have, maybe you think about what I said, and maybe even take action, because this is coming up more and more. And you have an opportunity to talk to your representatives in Congress